Our lesson for today is on rules on punctuations. Good fences build good neighbors. This was written by Robert Frost when he was referring to boundaries. The same is true with our medical reports. Reports properly fenced with the correct punctuation marks would build better accuracy and would be well understood. Why do we need to punctuate? Punctuation marks are signals to your readers. In speaking, we can pause, stop, or change the tone of our voice. In writing, we use different marks of punctuation to emphasize and clarify what we need. In general, here are the rules on punctuations that we follow as applied in medical transcription. First, we have the hyphen. The hyphen is used with ages when they appear before a noun they modify. The hyphen is also used with the word well as an adverb. Often we hear in dictations with the patient being described as well hyphen developed, well hyphen nourished. Next, we hyphenate a word to join a single letter and an adjective or participle modifying a noun. The comma. The second most commonly used punctuation mark is the comma. Clearly, in medical transcription, a comma is used to separate adjectives or nouns in a series. But remember, a comma is no longer placed between the last adjective series and the noun that follows it. An example for this is, the patient is a 67-year-old, comma, frail, comma, disoriented female. Note that on the last adjective, which is disoriented, no comma is needed even if it is still part of the series. Titles and degrees of doctors are often included in the reports. These are also separated by a comma pair. Example would be Marion Jones, MD, comma, has agreed to see the patient in the emergency room. When a disease entity is followed by the location of the body, we also use a comma. Deep venous thrombosis, comma, right leg. Third, we have the colon. The colon is another important punctuation in medical transcription reports. It is usually used after a heading and subheading in a medical report. Here are some examples. History, colon. This is a 57-year-old, comma, white female. History is separated by a colon from the words following it, considering the fact that history is a subheading of a medical report. We also have heart, colon, regular, rate, and rhythm. Fourth, we have the period. The most commonly used punctuation in our medical report is the period. A period is used to mark a closure or used as a mark of separation and the end of every declarative sentence. The patient's past medical history is unremarkable, period. Or complications, colon, none, period. Another important use of the period is to separate values of unrelated tests. For example, results of hematologic blood tests, comprehensive metabolic tests, urine analysis, and other laboratory tests are separated by a period. We usually encounter them in the diagnostic data part of the report. For example, white count is 5.9, period. Urine specific gravity is 1.01, period. We also have the apostrophe. An apostrophe has many uses. Most common to us is to show possession and form some plurals, as we have seen in our previous lesson, and to denote omitted letters or numbers in contractions. Here are some examples of the common use of the apostrophe. To show possession, we add the apostrophe, then add an S to the word showing possession. Example would be the patient apostrophe S symptoms include Dr. Harris apostrophe patient. Next, an apostrophe is also used in the expression of time and measurements. So, when we hear a dictation that says the patient is on her 20 weeks gestation, we transcribe it correctly as 20 weeks apostrophe gestation. Knowing when to use the apostrophes is as important as knowing when not to use them. In medical transcription, the rules generally reflect those of the common usage. Let us see a medical report and apply the rules of punctuation. These are just some of the basic rules our style guide and medical transcriptionists must remember. In the succeeding lessons, we shall deal more on other rules. Thank you for watching CITESI's Pay-Per-View University, your classroom inside your TV set. My name is Adora Amor Balawan, your medical transcriptionist trainer.